Welcome, everybody, to the final module of Dissemination Essentials. And this one is on ensuring transparency and building trust. And due to popular demand, we'll also be talking about an introduction on how to evaluate your dissemination work. So just some Zoom essentials to mute yourself when you're not speaking. If you'd like to ask a question, you can either do that via chat or turn on or off subtitles if you'd like to have a visual of what we're saying. And if you'd like to participate verbally, feel free to raise your hand or just unmute yourself and chat that way. So the first part of our module today is a brief video actually on ensuring transparency and building trust. So that covers checklist items 9, 10, 16, and 17, which may seem like a lot of checklist items, but in reality, they're quite short and easy to apply to your products. So who better than to share that information than one of the original creators of the dissemination checklist, Sarah Rosenbaum. So we're going to play a very brief video from her on this, and then we'll come back for any questions or discussion you'd like to have before moving on to the evaluation portion.
Hi, my name is Sarah Rosenbaum from Cochrane, Norway, and I'll be talking about ensuring transparency and building trust when disseminating findings from Cochrane reviews. A well-done systematic review is usually a more reliable source of effectiveness evidence than a single study, and should command more trust. But many people don't understand the difference between systematic reviews and single studies. And even when they do, they might not be aware that your dissemination product presents the findings of a systematic review rather than a single study. There's some basic things you can try to always do that can help people who are unfamiliar with the concept of a systematic review. First, remember to state that the findings are from a systematic review. If you have space, you could include a short description of what that means, like in this example. In the checklist, you can find more examples of brief ways of describing a systematic review. Also, you should refer to the number of included studies in the review, since this helps support people's understanding about how a systematic review differs from a single study. This strategy can also be useful for more expert readers who could be actively looking for that information. People both want to and need to know how up-to-date the evidence is. So, at a minimum, you need to include the publication year of the review that you're reporting on. Probably the most precise way to indicate how up-to-date a review is to state the date of the most recent search for studies. However, you need to consider your target audience, as the publication year may be easier to understand by people who are unfamiliar with systematic review methodology. For transparency, people need to be able to see who produced the information, both the review and the dissemination product. And knowing that the information comes from a Cochrane review can increase its trustworthiness. You should always visually label your dissemination as coming from Cochrane by using the Cochrane logo or the logo from your entity or review group. You can strengthen this visual connection by using the tagline, the colors, and the fonts specified in the brand guidance. The easiest way to find these are just to search for Cochrane brand guidelines. But not all people are familiar with Cochrane. Some people might think Cochrane is a commercial company or an extension of the government, and this might impact their sense of trust. So it may be important to emphasize that Cochrane is an independent, non-governmental, not-for-profit organization. Also, you might consider collaborating with other individuals or organizations that your target audience is familiar with and perceives as trustworthy when planning dissemination output. For reasons of transparency, your target audience should also be able to find information about who the review authors are, how the review was funded, and if the authors have any conflicts of interest. At a minimum, provide the access to this information, for instance, through a link to the review. You might also consider including a link to Cochrane's conflict of interest policy. When it comes to information about funding or conflict of interest, not all people want this level of detail. And it might also depend on the review you're reporting on, whether you anticipate controversy around these issues. In any case, this kind of information should be easy to find for those who do want it. Making information easily accessible is an important part of building trust. This video is one of a series of videos that are based on the Cochrane Dissemination Checklist. The easiest way to find the checklist is to search for it online. Thanks for watching.
Or I guess a remote thanks to Sarah for producing that video for us. Does anybody have any questions that they would like to talk about related to what you've heard in that presentation about ensuring transparency or building trust before we move on to evaluation? I guess one thing to add and to mention related to this, based on how people have received this information before, is that sometimes with the title, Ensuring Transparency and Building Trust, you might expect that there is more that you would have to do or contribute to ensure transparency and build trust. And I guess the bottom line with that is, when creating dissemination products, you do have a limited ability to use that dissemination product to ensure transparency and build trust. So what that video basically showed were small things you can include to help people trust the information better, but ultimately a lot of people's trust when it comes to the information source or information delivery method comes down to things a bit larger than how you are disseminating it, and more based in the environment that you're disseminating in, and the reputation of the organization that you are disseminating from. So these are just some small things you can consider that you have direct control over as disseminators to ensure transparency and build trust. Okay, we're going to move on, but if you do have any questions, we will answer them in the chat as we move forward. So we're moving now to the more substantial content of this webinar, and that is a brief introduction to evaluating your dissemination products. So I'll be kicking things off to talk about this, and then I'll pass it over to my colleague Elena, who will talk a bit more about this. And Juliana will also be available to answer any questions that anyone might have on this very rich and full topic. We're going to try and give you a brief introduction, but the reality is we could have an entire course on this. So we're here to help and to explore this topic a bit more with any questions you might have. So first, we're going to start out with 2 questions, just to gauge what your mindset is around evaluation. So to participate in these questions, there's a tab at the top of your screen. And if you click on View Options and then Annotate and then Stamp, you'll be able to stamp along this line where you agree or disagree with the statement. So this first question is, how important do you think it is to evaluate your dissemination products? So we got 0 being not at all important, 10 being very important, and 5 somewhere in the middle. Okay, I see a lot of stamps down on one end of the scale. Some a little bit closer to neutral, which is fair. I mean, in the grand scheme of things, you have to do a lot of stuff as a disseminator, so perhaps this isn't perceived as important as other aspects. But for the most part, you all seem to think it's quite important. So might wait another second or 2, and then we're going to clear the screen and go to the next question to start stamping again. All right, let's head over to the next one then. So the next question, how easy or difficult do you find it to evaluate your dissemination products? We've established that it's important, but in reality, how easy is it to do? So same as before, view options, annotate and stamp, and choose your number. All right. Seems like the majority is below neutral. So it's more on the difficult end of things. Fair enough. It's a separate skill set that you kind of need to develop and then have time and resources to do. So hopefully with the presentation today and some of the easy to use tools we're giving you, you'll be able to get on your way to finding it a bit more easier to evaluate your dissemination products. Okay, so we can clear the screen and I'm gonna move on to the content. Okay, so why evaluate? And I mean, generally speaking, it seems like everybody already knows why it's important to evaluate. But I'll add a little bit more color to why, especially at Cochrane, we really are supporting evaluation of knowledge translation work. So the first is to see whether you're achieving your dissemination goals. So you're doing, this dissemination work for a reason, and it is work. So it's really useful to see if the effort you're putting in is actually having the intended effect. Otherwise, it would be wise probably to switch up what you're doing to something different. Another reason to evaluate is to better reach your target audiences. And I think we all agree at this point that reaching our target audiences is one of the most important parts of dissemination. So by evaluating, you'll have a sense of how well you are doing that and what you might need to shift or change in order to better reach your audience. The next reason why you might want to evaluate is that you will know what to prioritize, continue, or stop. Because once you've evaluated, you have this knowledge now. You have knowledge and data to make decisions on, and you can make informed decisions about where you put your time and effort and energy moving forward. And that knowledge and information is always a good thing to have to back up what you're doing and why you're doing it. And this obviously leads to the next place, saving precious resources. I mean, most disseminators at Cochrane have a limited amount of time and money and people to do this work. So it helps to know what things you might want to continue or stop or change. And lastly, and this is incredibly relevant today, especially within Cochrane, is that it's becoming more necessary to actually prove your impact and what it is that you're achieving with the work that you're doing. So when you evaluate, you're armed with data and information that you can show to stakeholders or to future funders to support the work that you are doing and potentially gain more resources. So I'm sure there are other reasons why you would want to evaluate, but those are the top ones that we've come up with. So we introduced to you just the tip of the evaluation iceberg, a simple evaluation plan. So this is meant to be used as a template, and it helps you think through the dissemination work that you're doing, why you're doing it, the things that you will need to do it, and then also sets you on a path that you can use to do a simple evaluation. So I'm going to very briefly go through these sections, and then I'm going to pass it off to Elena, who's going to do a much better job actually coloring it in with examples. But just to get us started, we have inputs at the top. And so when you're filling this piece out, you're basically putting any resource or material that you need to do the dissemination work or product. You're capturing all of those available resources. Maybe you have them already, maybe you'll need them, but you're putting them there so that you have them all in one place. And then in activities and outputs, you're describing what you'll be doing with those inputs. Will you be hiring a graphic designer, or will you be using in-house knowledge? Will you need access to a website or a web page to be able to create a newsletter, or partnering with an organization to do that? So you're basically listing out the dissemination activity that you will be doing. And then the output is what you've created. So have you created a tweet? Have you created a newsletter? Have you created a blog shot? you know. So that's the output, is the tangible thing that comes out of your dissemination work. Next is audiences and stakeholders. So who you're trying to reach, and trying to be as specific as possible there. So it makes defining outcomes easier. So then you move on to outcomes, and that's essentially, it's a pretty full area. And again, I'll wait for Elena to tell you and give you examples of what they look like. But this is actually what happens now as a result of the dissemination product or activity that you have put out there. What is changing in the audience? What is changing in the short term, immediately? Do they have more knowledge than they had before? What's changing in the medium term? Maybe they're using that new knowledge to apply to their healthcare decision making. And then what's the long-term effect of that? Improved health outcomes, perhaps. So this is where you kind of, list in a timely way, from short, medium to long term, what you can expect to see as a result of your dissemination activity. And then the two bottom pieces are very specific to evaluation. So indicators of success is basically detailing how you will know you've made that outcome happen, and how you will measure whether or not you've just achieved that desired outcome. And there are a number of ways to do that, which I'm going to, again, pause on. And lastly, data collection tools and approaches will be how you collect your information to track your indicators of success. This is the actual evaluation work, so to speak. It's the tool or the resource that you'll be doing to gather that data and information to evaluate. So this might seem like a lot, and I feel like I just went through a lot of different substantial sections, but I think it will become more clear as we walk through an example. So for that, I'm going to pass it over to Elena.
Thank you, Stephanie, for the nice introduction of the Simple Evaluation Plan. My name is Elena Kostova. I'm the managing editor, Cochrane Gynecology and Fertility, satellite based in Amsterdam. And I'm also responsible for the knowledge translation activities within our group. So not just the reviews published by our satellite, but published by our group headquarters based in New Zealand. And I'm very excited to be here, though I'm also a bit sad because this is our last module and I really enjoyed the course. I hope you did too. And now I'm going to give you some examples of how you can implement what Stephanie just explained really well. I must warn you that I'm going to give you some really simple examples. And I hope you can take this home and implement it in a useful way and apply it to your work if you find it useful. Let me start sharing my screen. Okay, I hope that works. Let's see. Yeah, can you all see my screen? Okay, thanks. So I will also do the same as Stephanie. I will start from the top with our inputs. So in this example, we will be doing an simple evaluation plan of the Cochrane review. So obviously as an input, we will also need the Cochrane authors to write the review. And we also need someone to prepare the dissemination product materials. And within our group, that's me. So I'm the managing editor. And I will be creating the knowledge translation materials, which is our outputs. And in our case, what did we do? We did a blog shot that we shared on social media, on Twitter. And audiences and stakeholders, that's also very important. And as Stephanie said, it's good to be specific. This will help you in the end target your materials better to your audience, though we understand it can be a bit difficult. So just try out what do we mean by define your audience better, be more specific. So I could have said, all healthcare workers is our target. But in my case, I say, okay, let it be fertility doctors because we are a gynecology fertility group. And let's say we're interested to target fertility doctors, but why not also members of the public? It's of course not super specific, so it might sound like we're contradicting ourselves, but defining your audience, it also kind of determines how you're going to prepare your product. And we learned we received some really nice tips in module 3, how we can implement plainer language in our knowledge translation materials. So why not try to make even if your target group is healthcare professional or a doctor, why not try to make your material, if possible, also a bit plainer, so maybe you can reach a bit of a wider audience. In our case, we say, let's say, patients undergoing fertility treatment, because that's what our reviews are focusing on. As an outcome, which is the change we want to achieve, we can also call it a goal. Let's start with the short term and maybe self-evident, or let's say maybe this year. Let's say we want to increase the reach of our review. We want more people to know that the review has been published. And how do we know if we have succeeded? What's the indicator of success? And here we said, well, 2,000 people have seen the post and we have received an Altmetric score of 20. If you don't know what some of these words mean, don't worry, I will explain next slides what Altmetric score is. But let's start with the views, post views of 2,000 people have seen the post. How did we decide on this number? Well, that's a very good question. And it can be based on, well, in your case, it can be based on something you've done in the past. Let's say you've posted something, you received 1,000 views, and now you're feeling lucky and you're like, I want to double that. Or say you have 2,000 followers and you would like all your followers to have seen your post, well, in theory. So, or you can talk to someone, a colleague, or maybe get in touch with Cochrane comms and be like, oh, I need more, I would like to know more about how I can determine what my indicator of success is. So what I want to say here is it's okay if you don't know the exact number. So you just have to start somewhere. In our case, the Altmetric score of 20 was based on the fact that usually when we have posted something about the review, dissemination product, we noticed that the ones that received relatively the more popular reviews receive a score at least 20. So we said, okay, let's try to reach that. And I'll tell you a bit more about the score in a bit. And data collection and approaches, since if we go back to our output, since this is a blog shot that we're going to post on Twitter, we're going to use Twitter Analytics to measure our success, indicator of success. And we're also going to use Altmetric score, which is logical since we are looking at Altmetric score as our indicator of success. Let me show you our tweet. So this is a tweet you can see we posted on June 17. And we're happy to say that we have tried to implement some of the nice tips we learned throughout the course, such as the use of hashtags, the tagging our collaborators. In this case, these are our two main authors. We have a visual, that's our blog shot with a relevant picture, because we are talking about in vitro fertilization. And most people think about that image when they hear about IVF. We have tried to layer the information. We have the tweet, we have a bit more information in the blog shot, and we also have the link to the review. And we have tried to implement the certainty of the evidence. As you can see here, we have used the grade wording that we are uncertain. And let's now move on to evaluating. If you're on Twitter and you click on this bar, then you will see the, so to say, simple tweet analytics per tweet, which is basically impressions, the times people saw your tweet on Twitter, and the engagements. And in our evaluation plan, we said, okay, we want 2,000 people to have seen our tweet, and we see we have 4,000 impressions, which, yeah, it's pretty good. Let's say we have succeeded. And another thing you can use to evaluate on Twitter is, of course, the engagement when very popular, likes, retweets, link clicks. So if you click on the engagements, we haven't done it here, but if you're interested in this, you can click, and that's also something that you can use in your evaluation plan. And the other example we wanted to show you of something you can use as a short-term evaluation indicator of success is the Altmetric score, now called Altmetric attention score. We'll just call it Altmetric score, it's shorter. Each review has one. So if you see here, that's the landing page, the review on the Cochrane library, and you see the M score in a bit of colorful. You click on it and you end up here. And you see a bit larger, the score, and it's 21, so good for us. We said 20, so we have achieved that very well. How the score is calculated, there is, it's an algorithm that calculates based on a formula based on what type of different attention did your review get. And in our case, it was mostly from Twitter. So that's why our donut is blue, because also the color of the donut changes based on what kind of attention the review gets. So that's pretty cool. And if you want to go a bit more into detail with the score and be like, okay, I just don't want to know the score, you can click here on Twitter demographics, see that's what you get. And I realize it's a bit small, but we can see here the occupation of the people that were tweeting about the review. And we can see that most of them were from the general public, which is good to know because we wanted to reach not just the fertility doctors, but the general public. So that's pretty nice to know. And even though we didn't include it as an outcome in our evaluation plan, it's also a very useful feature if you would like to see if you're reaching a more diverse geographical audience, especially since Twitter Analytics removed the geographical and demographical analytics from, Twitter removed it from Twitter Analytics some time back. And just another last feature of this Altmetric score, if you click here on Twitter, you get the so-called upper bound of followers. So that's basically a sum of all the followers that have tweeted about, so let's say, to make it clear, let's say you tweeted about it, and then Cochrane Library tweeted about it, one of your authors tweeted about it, and Cochrane Library has 80,000 followers, and the other person that tweeted about it has 20,000 followers. So in total, you have this so-called 100,000 reach, right? Of course, there is no way to know if anyone who followed the person who tweeted about your review saw their post, but that's still something we call reach, and it's good to know that, if your post gets retweeted or shared by other people, that basically increases your reach, and it's a good way to keep in mind that this way you can reach even a wider audience. And if you want to know more about how the score is calculated, here is the link on the Altmetric website. And now, after we discussed how we can evaluate a short-term outcome or our short-term goal, let's go a bit further. Probably even more people will be interested. Well, I posted the review. I posted the dissemination product about the review, and I want that everyone implements it in their practice tomorrow, right? That would be ideal. But let's see. Not be so. Don't be so hasty, because it's good to start more realistic. So it's completely fine to start with just your short-term goal. What we just explained. The review, it's posted, then people know about it, and they tweet about it, in our example, social media. But then we don't know what they're doing with this. They know about it, they've posted it, they share it, but that's fine, that's completely fine. But we want to know a bit more. So let's say we would like to achieve something further, not just people know about it. And the next logical step could be, okay, people know about the review that has been published. Now we want them to download it. And of course, we hope that once they download it, they also read the review, right? So let's say we want people to download the review, and we want that the review site gets more citations. So this could be a medium-term goal. And as a long-term goal, we would like our review findings to be applied in practice, or at least it could be local in a certain country or in a certain region. And we realize that sounds very broad and not per se super easily achievable or easily measurable. Yeah, we appreciate that, and probably you do too, which brings us to what we started with. It's also okay to start small, but it's also completely fine to make a bit of a long-term plan. So it's just something you can do with your evaluation plan. And just to discuss briefly what an indicator of success and data collection tool could be for our medium and long-term outcomes. In our case, let's say we want 2,000 downloads and 50 citations. Again, we can say, okay, what do we base this on? Similarly to our 2,000 views. It could be, again, something that you have based on something you've done in the past. Say a very popular review previous year received 1,800,000 reviews. And now you're like, okay, we want to receive more, or the same with the citations. It's it's just an example. This is not based on real data, unlike the short-term outcome we presented, but it's just something we want to share as an example that you could use. And as a long-term indicator of success, let's say the review is cited in one very big guideline that dictates practice. And of course, here we also make an assumption that once the review is cited in a very big guideline that dictates practice, that healthcare professionals apply this guideline in their practice. So yeah, it's again not so easy, right? That, oh, are we achieving our goal? So something to keep in mind. And in terms of data collection tools, you can use, of course, for the downloads and the citations, very straightforward. You can use number to how many times reviews downloaded or accessed or cited. And all this is available in the impact report from Wiley. If you are responsible for a group and you receive these reports, the reports for last year, 2020, were sent just the end of last week. And you have this information for each review per year. And there's also the guideline usage report from Cochrane UK, and Cochrane UK keeps track of each review, whether it's cited in a guideline, and that's available also on the landing page in the Cochrane library, actually really close to where the Altmetric score is. So if your review is cited in a guideline, you can see that in on the Cochrane library. Another thing you can do is check Scopus, for example, but for citations, but for this you would need institution access because it's not freely available. And while talking about indicators of success in data collection of medium and long-term outcomes, it's good to talk about timeline, because unlike our short-term outcome, which was how many views, or it can be how many likes, retweets, whatever you choose, especially if it's on social media and it's so dynamic, it's completely fine to say, okay, I would like to receive these 2,000 views 2 weeks after I post the tweet or the blog shot. That sounds reasonable, because probably you'll get it already soon after you post it, because that's how things work on social media. Everything happens now, at the moment, very dynamic. But it's very unrealistic to expect the same happening for your medium-term goal and long-term goal, right? So it's completely fine if you determine a bit more realistic, longer timeline. From now on, you can say, okay, I received the 2,000 downloads of 50 citations within the next year, within the next year and a half. And about the guideline, you can say within 1 or 2 years, our review is cited in very important guideline. So it's good to keep in mind that different timelines will apply to your different outcomes, and that's completely fine. And it's also realistic. And I would like to end with a few tips, call them top tips for evaluation. But as we go through them, you'll see that they're actually also tips for knowledge translation, which brings us to the first take-home message, that you can't have evaluation without knowledge translation, and these go hand in hand. So the more dissemination, the more knowledge translation you do, the more evaluation you will be able to do, and with time, perhaps a bit more streamlined, a bit more easier. So yeah, just give it a try. As we said, be specific. Think about your stakeholders. Who are you writing your products for? What are your goals? Depending on what you want to achieve, this will determine what you're going to measure, but also the other way around, which brings us to the tip. You can start anywhere. If you look at the simple evaluation plan, while we were talking about it, we started from the top. What are your inputs? What are your activities, stakeholders? But you can certainly start from the bottom if you want. That's also fine. Say one of your colleagues it's really good at Google Analytics. So you can say, okay, well, maybe we can use this resource and then write a blog or a website and use this person who can help us write a nice evaluation report using Google Analytics. So that's completely fine. You can start anywhere. And speaking of using someone, if you have the resource to help you, it's really important to collaborate if you can. You don't have to do everything by yourself. Collaboration in social media can be really simple. It can mean just tag someone with a lot of followers. That usually increases your visibility. And I can give you an example with a tweet, with a blog shot we just posted. We posted the same 10 days later. but tagging the Cochrane library. And this post received almost double the attention that the post I showed you. So that helps. And yeah, post frequently if you can. You can also post about older reviews. That's also fine. You don't, at least we are a big group. We don't have, even though, yeah, we have a lot of reviews, but you know how long it takes to publish a review, and it's completely fine that you don't publish a new review every day or even weekly. So you can also post about older reviews. You can join awareness campaigns just as long as they're legitimate. We have done this, our group has done this for Polycystic Ovary Syndrome Awareness Month, for example, or Endometriosis Awareness Month. Don't be afraid to experiment, which brings us to a very good point. What you might be wondering, okay, what do I do if I realize I'm not meeting my goals? Stephanie touched upon this during her part of her presentation. That's a very good question. Also very realistic. It could happen. And you can just try to do different things. You can, as I said, try to tag someone else on your post at different times. That can also work. Let's say you're based in the States, but most of your audience is in Europe or in Asia, but you don't have to get up in weird times. You can just schedule some posts on social media management platforms. That's completely fine. You can try a different platform. Not everyone is on, our example was on Twitter. And in our case, the gynecology and fertility community is pretty active on Twitter. And all our big societies are on Twitter. So for us, it's a logical place to disseminate our reviews on this platform, but might not be the case for everyone. So it's completely fine. If you try a different platform, you might even go very out of the box and even try TikTok if your reviews are to target a bit younger audience. So you can try that. You can try, as I said, different things. If you have someone to help you with other things, such as Google Analytics, then you can write a blog, or you can just post something on your Cochrane group website if you have one. We've done that. When we did Endometriosis Awareness Month a couple of years ago, we didn't receive the attention we wanted on Twitter, but we also posted the website page dedicated to the Endometriosis Awareness Month on our group website. And actually, it's still today the second most visited page on our website. So that's pretty good. It didn't work for Twitter, and now we post a bit less on Twitter during the campaign, but we always update our website, and that's always very well visited. And yeah, as an end to my tips, just don't forget that analytics are just tools, but it's a good start. And yeah, it's a relatively easy and straightforward way to try to evaluate what you're achieving with your knowledge translation activities. And don't forget to keep it simple. Thank you.
Thanks, Elena. We've had some messages on the chat while you've been presenting to get us started with our discussion. I think the first one, though, you already answered when you were going through the latter part about your defining a time period to achieve the outcomes. I don't know if you wanted to mention anything more about defining a time period to reach outcomes in evaluation.
Yeah, for our, for example, when we did the awareness events on social media, if it's a month, so let's say Polycystic Ovary Syndrome, it's in September, then we do it for the whole September, for all tweets we did on this topic. But in the example I gave you, and as I mentioned, because it's on Twitter, it's very dynamic. Usually you see your, if you, within a week, you would have gotten your attention. So a week for social media, it's fine. Yeah.
Okay. Thank you.
And maybe just to add that, I mean, that's something that would be important or useful to specify whenever you plan an evaluation, that your indicator of success or your indicator of success and your data collection actually specifies when you plan to achieve something and when you are measuring it as well. And also maybe that could be over a longer period of time where you say, okay, in the first instance, we're going to look at the figures in a month, and then we're doing it again in 2 months to see how we're progressing with our activities and what we want to achieve.
Good point. Good point. So Andrea has a couple questions. The first is, how can we measure success when the target audience is the general public? Do either of you want to take a try at that?
I can have a go if you want, Elena. I mean, I think generally, I guess it's perhaps, I think, Elena, you actually pointed to that a few times in your presentation, but the example that you gave is just one way of how you could measure success. And I guess that's what perhaps people find difficult about planning their evaluation. There's not really a clear rule book for how you measure which kind of activity or success. So you have to come up with something that works for your capacity, where you have enough resources to do it, or that works in your context and in the example that or in the activity that you want to measure. We can help you define that and give you guidance on specific cases, but there's not a clear, if you do this, you have to measure it in that way. And the same thing that Elena presented, you could try to measure it in different ways. And I mean, Andrea, to your specific question, it depends what your activity is. So if you're saying you want to measure whether fertility doctors look at the posts that you put on social media, you could try to do that, but I'm not sure it's the best way to do it, but you could try to do that by looking at who the people actually are that look at your posts, or you could define specific organizations that you want to see or share your posts. So in that example, you could try to see whether the patient or healthcare associations that work in fertility regulation actually share or look at your posts or retweet them or do something else with it. So that would be then a very specific definition of how you measure success for a certain post or topic. But maybe if really your main goal is to see whether fertility doctors use your evidence, maybe Twitter is not the right way to achieve that success. So doing an evaluation plan can also help you look at whether the activity you're doing actually matches really well with the outcome that you want to achieve. If you say that the people you really want to achieve are fertility doctors, maybe there are different ways of doing that than posting on Twitter. Something a lot of groups do is, for example, share evidence in specialist journals. And in that case, I guess you'd be very clear that the people who read this journal are probably mainly fertility doctors or healthcare professionals in that specialty area, and you're being perhaps already more targeted with your activity. But that's just as an example. So it really, and I guess that's back to the point of try to be really specific who you're trying to reach and what you're trying to achieve. And that sort of may shift around some of the activities you're focusing on and how you measure them as well. And one aspect that's also, I think for most of you, that's always kind of implied because you know it, but one of the things you can also specify in your audience or what you measure is the language or country that you're targeting. And in some cases, maybe it's actually global, but I think in reality, a lot of your activities are specific to a certain language or to specific regions or countries. And it's worth specifying that, even if in your head that's clear, because that also helps you be more specific with what you actually measure.
Yeah, and that kind of touches on a bit of what Andrea was asking in her second question about approaches to take when you're evaluating the impact of one type of product. So if you are just targeting a single like translated product or a single geographic area, as opposed to like dissemination products built off of one specific review, whether there'd be different approaches for that.
Yeah, absolutely. I mean, if you say you want to know, like in your examples, how the impact you achieve with all podcasts that you translate into Spanish, and you probably share them in different ways, that starts to get more work to try and evaluate that. So you could say, if there's maybe one specific way of how you share them usually, that's where you put your focus in terms of measuring it. Or you could think about, okay, what is actually the platform that is most suitable for sharing podcasts in Spanish, and focus on putting your dissemination efforts into that. So I don't know, but maybe if you share it through something like Spotify or iTunes, maybe that's where it's most likely that you'll reach the audience that actually listens to podcasts. Or maybe it is through your social media activities where you would measure it. Or you want to look at web statistics of where you posted. But I think in that regard, again, to try and think that through can help you also make your activities themselves more strategic in terms of where you disseminate, where you put your attention. But again, there's not just one straight answer.
No, we of course the example we gave, it's a very simple. I understand that it was just one review, one blog shot, of course. But technically, or if I understand the question, Andrea, you also say, blog shots published in social media. So you can also do that if you're on social media. Just use social media analytics to track at least the views. You can track link clicks, so you can directly know someone went to the review from the post. And if you are hosting all your blog shots on a website, then you can use Google Analytics to see how many people end up on your page.
It's a good tip as well.
And I guess to sort of draw the line back to the beginning of why you're actually doing the evaluation, say if you measure whatever it is you decide to measure and you don't actually see the success that you want to see, then that's perhaps the feedback or the indication to you to think about, okay, well, why do I not achieve the success that I want to achieve? And is there perhaps a better way to try and achieve the outcome that I want to see?
Absolutely.
Dario asked about their techniques to increase the number of retweets. Well, there are people whose job is to write books about this. But in our experience, usually images work, and tagging, for us, tagging the Cochrane library or Cochrane. So that has worked for us. And just targeting your post to, as Julian and Stephanie said, the people that you would expect to be active in your community, right? You can, with them, they will help you spread you. In our case, we are a small group. We have 1,200 followers on Twitter. That's for many people not much. But if some of our followers are interested in our content and that they make it spread and available to more people, to their followers, that's usually helpful. Yeah.
Great. Thank you both, Elena and Juliana, for pitching in and answering those questions. Much appreciated. And if anyone else has any other discussion questions or comments or things that they get stuck with evaluation, we invite you to post on LXP, and the three of us will put our heads together to do what we can to help you and answer your questions there. So thank you for that. Speaking of LXP, I'm going to talk to you a bit about what's on there for the rest of Module 6. So what we shared today was just a brief template, but there is a full evaluation resource that Cochrane has created that is on the training site. And this is also linked to in Module 6. So we encourage you to take a look at that and try and apply it to your work and let us know if that is helpful or useful to you. So in addition to the full resource being up, we have a brief evaluation template, the one that we went through today, and we invite you to practice putting it into practice. So we will all be available on the Learning Experience platform to help you with this. But the task is to download the template that we shared today off LXP. It's in a Word document. To fill it out as briefly as you'd like with a dissemination product or activity that you're doing or have done in the past if you're not currently working on anything, and then re-upload it to LXP. And we will comment, or you can comment on each other's, and you could ask any questions that you have related to that activity. And then the last thing on LXP is the course evaluation survey for the entire course. So I will get to that in a short minute, but I'd just like to take this opportunity to thank Elena and Juliana for joining me to talk with all of you about evaluation today. So we have come to the end of Dissemination Essentials, 8 long or short months, depending on how you felt about it. We've included a sad face and a party face, so choose your emotion, I suppose. But we just wanted to thank you all for joining us on this course. It's a new endeavor for us at Cochrane to sort of do a dissemination course like this. And we're grateful for you all for helping us along this journey and for being here and participating in the learning to the extent that you have. And I wanted to also thank all of our wonderful trainers for enriching the program with their knowledge, as well as the learning support staff for organizing everything, the online platform, the Zoom calls, all the live sessions. There's a lot of people who helped make this course what it is, and we're very grateful for that. So we have a few brief minutes now. We were hoping that you might want to participate via chat. If you feel like it, you can unmute yourself and share that way. Just share one new thing you've learned from this course. We're really curious to hear the one thing that stood out to you the most from the past 8 months. Maybe it's something that you didn't know before, something that you've applied in practice already, but what's the one thing that has sort of enriched your dissemination work as a result of this course? I will look at the chat. Elena, you're a member of the course. Do you want to share something that?
Yeah, I was going through the modules because I didn't remember exactly which module we learned what, and I'm sure it's more than it's for me. It was really a very interesting and useful course, and I learned a lot. It's nice to have everything under one roof, and I think that if we all think about the amount of content and resources we have, I can't imagine now. I like this. I download every for every module in every folder, everything available, and I put it on my computer. I don't know if everyone's like this, but thinking about it, if I have a question, there's no possibility it cannot be answered if I go to the respective module. But to answer your specific question about something new, I think for me it was probably the plain language module, because there we learned so many nice tips, not per se super new things, but very useful things you don't realize, like, oh yeah, this is something that if we implement this, make things so much better, like passive voice, or how many sentences in a how many words in a sentence, make it the readability for which audience is it appropriate. Like, we don't working in Cochrane, we don't realize all the terminology we use. That for us it's very straightforward, but probably not for everyone, which is completely fine. So I think for me it was the plain language.
It's great. Thanks for sharing. And I see a few of you have shared on the chat as well. The zombies thing, that was part of the plain language section, right? Yeah. Okay, because at first I was like, I don't know. I don't remember that. But yes, we had such creative ways the trainers did in terms of how they shared their knowledge sometimes, which was really great. Great. Love to hear this layering. Yep. Importance of including your audience. Confidence to create a dissemination product. Wonderful. It's great to hear all of this. And you'll have an opportunity to share even more in the course evaluation. So please keep sharing your thoughts on the chat. We're going to capture this afterwards. But I just want to make sure I can deliver the last few messages of the course in the next 3 minutes to all of you. So I keep talking about this course evaluation survey because it's the gift you can give back to us. You can tell us as participants what you thought about the course. And in the true nature of evaluation, it really helps us determine whether the resources and time that we've put into this produced what we wanted and how we can improve that if we decided to do that in the future. So the course evaluation is anonymous. It's on LXP. There's a link to it. And we're asking that you please complete it by Friday, November 19th. We would love 100% course completion or participation completion. That's our metric of success. We'll see if that was too ambitious or not. Yeah, we'll take a look there. And if you have any feedback that you don't want to give anonymously, feel free to post it on LXP. Feel free to email me directly. We'd love to hear anything you have to say about the course, good or bad. We're really keen on improving, so let us know how you felt about it. And just some last important info. There's no Ask the Trainer session for this month. So this is the last live session we will have with all of you, but we will still be on LXP answering your questions there or providing feedback that way. So feel free to keep engaging with us on that site. They'll be sent around some course certificates for your participation. So you can have proof that you've participated in this course to make dissemination better in case that's of value to you. And you'll be able to access LXP until the end of January 2022. So we encourage you to do like Elena and go on and download anything that you like, anything that's of interest to you to keep for your own resource. Yeah. And I guess that takes us to the end. So I'm sure this isn't the last we'll be seeing of you, but we'd really like to thank you all again for being here. And thanks to all the trainers and the learning staff for making this happen. It's been a great community, and goodbye and good luck with disseminating. And we're always just an email away in case you have any follow-up questions with dissemination. But take care, everyone, and we'll see you later.
Thank you. Bye.